people will never forget how you made them feel. And that is so important. And we did that as well by having all our management level individuals have the empathy training so they can communicate with their employees, not just with patients, but their employees, to communicate with them effectively so that they can mitigate, overwhelm. And for us, over the last 12 months, 3% employee turnover for, hundreds of different, physicians that we partner with, and also, dozens of nurse practitioners and that we kind of employ directly, and they just don't leave, right? Because, the 3%, I think the average is like, 8 to 12%. So, definitely our goal is to kind of keep that going. Granted, it's only been 12 months and we're kind of constantly looking at that data. But the goal is ultimately to make sure we reduce that and keep employees happy. And this is with, mind you, very little increases in financial options. So 9 times out of 10, people don't leave because it's financial reasons. They typically leave because of other organizational issues with burnout. So thank you for your time. I want to kind of tell you, my goal today was to kind of give you these lessons that we learned in helping guide clinical teams and hopefully inspire you to action to make those changes yourself inside your organizations and design workflows around that. And then also, was to, provide frameworks you can apply today to make this balancing act a heck of a lot easier. And one of the things we talked about today was just building team culture to overcome resistance, right? Talked about that 4F framework, right? And how that can help you build out for the team building so that you can have the structure around a foundational understanding of what the core problem is, understanding the failure loops, understand how do you get fast feedback, right? And then focus on the success ones. The fix isn't more automation. It's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.